In today's episode, we are going to be talking about the top 10 blood tests to get before you transition to any diet, particularly the carnivore diet. Number one is cholesterol. Now, I know people are going to be thinking, oh, great. Okay, this guy's talking about cholesterol. He's just another doctor who wants to put people on statins. No, that is not what I want to do. I like to deprescribe. I like to stop medications and don't like to start them in the first place where I can. But especially on a carnivore diet, we can see problems, we can see issues arising in cholesterol. Now, LDL cholesterol, I'm not going to get into all of that in this episode. This is just a quick video this morning. LDL cholesterol has never been shown to cause heart disease in humans, but it is strongly associated. Anyone that tells you otherwise does not, frankly, know what they are talking about. However, whilst most people will do fine on the carnivore diet specifically, some people can get grossly excessive LDL and total cholesterol levels. HDL doesn't really seem to be affected that much. LDL and total cholesterol go up dramatically. Now, yes, there is evidence in certain populations that higher LDL cholesterol actually can be very protective, and I definitely agree with that. But I've seen some absolutely insane numbers that would really make any doctor extremely nervous, and people can get a little bit blasé about it. The kind of levels I'm talking about, I've seen people go from maybe 5 millimoles per litre, which is what we use here in Australia, up to 25. And to give you an idea in terms of US units, that 25 is about 967 milligrams per deciliter in American units. Almost 1,000 milligrams per deciliter of cholesterol. That's a very large number, and we don't know how dangerous that actually is. There is good evidence that the higher the LDL cholesterol goes, the worsening the risk of death. And people like Paul Mason, who I know people are going to quote on this saying, well, Paul, he says it's not a problem. Actually, he said that high cholesterol is also an issue, extremely high levels. The risk of death does also go up.
I've demonstrated that higher LDL levels are on average associated with longevity. That doesn't mean that every case of LDL elevation is a good thing, however. Take this graph of LDL versus mortality. You can clearly see on the left that the greatest risk of death is with the lowest level of LDL. You can also see that risk increases, although less so, with the highest levels of LDL.
There's also risks of things like kidney disease from excessively high cholesterol levels. More importantly than that, though, is the oxidized LDL. LDL cholesterol isn't necessarily overly concerning, apart from potentially those very, very grossly elevated numbers. But oxidized LDL, damaged LDLs, the small dense LDL, this is a big problem. And I have seen this get worse on the carnivore diet. And to be fair, any diet, of course, can make it better, make it worse. LDL subfractions is really what you're looking at here, which will break down the actual LDL numbers for you to show you how bad your LDL cholesterol actually is. In Australia, this costs about $125. Any GP can request it if they know what they're requesting. Most won't because they won't know what they're talking about. If you're having any difficulties, look, people can always consult with me. Otherwise, you can go to somewhere like iMedical and just get this done yourself. Really important. I recommend everyone gets this done at least every 6 months, if not every 3 months to start with, to just make sure that it's actually getting better and not getting worse. And this goes for any diet, but particularly on the carnivore diet. Number two is fasting insulin. Now, most people listening to this will probably know what fasting insulin is already, but this also should be paired with fasting glucose ideally as well. Fasting insulin is a very good marker for insulin resistance and insulin sensitivity as a standalone blood test. Very useful, as I said, when paired with the fasting glucose, but even just by itself is very, very useful. Most people, when they're doing a carnivore diet, will find that their fasting insulin will dramatically improve, very, very quickly, in fact. But some people can find in the long term, fasting insulin can actually start to worsen. And I believe it's a very sensitive marker for cardiovascular health and for insulin resistance. There's other markers available, which we'll come to. But this is a very, very simple blood test. Again, any GP can request it here in Australia. If you really have to, get them done yourself at iMedical. I have no affiliation with iMedical. I just know they offer this service. Number three is a full thyroid panel. Now, again, here in Australia where I work, Medicare won't cover a full thyroid panel unless you have very good reason. You meet those Medicare item descriptors. It will cost you about $50 privately to get a full thyroid panel, TSH, T3, T4. Reverse T3 you can do as well. It costs about an extra $20-$30 here in Australia. I don't think it's that useful to do. I don't really recommend that. I don't request it routinely. If people want it, I'll request it. But T3, T4, TSH, definitely a good idea. Thyroid function is intricately linked with diet and metabolism, what we eat and how we live our life. And any changes in your diet can affect this. Now, TSH is a very interesting one. We do see TSH, thyroid stimulating hormone, going down on a carnivore or a ketogenic diet. What we don't know is that good or bad? Now, the assumption is that TSH going down is beneficial because, well, we're doing a carnivore or a ketogenic diet, carbs are bad, therefore TSH going down is seen as a good thing. But what can happen, again, long-term low carb, long-term ultra low carb like carnivore, TSH can start to drop to pretty low levels, and the T3 and T4 can start to go out as well. And this lends at least some credence to this idea. People like Paul Saladino talking about thyroid actually needing some base level of carbohydrates to actually support it. Whether that's really true or not, look, I don't know. I have seen some issues again on long-term carnivore diets with the thyroid. So it's definitely a good one to get checked. You don't need to get that checked every 2-3 months, but just every once in a while, probably every 6 months would be a good idea. Number 4 is iron levels. Now, iron levels, I recently did a podcast actually with the Aussie Carnivore Connection, and we were talking a little bit about iron, and I had to interject because they were saying that iron wasn't an issue on carnivore. Well, sorry, it is. It is an issue on any diet, potentially. Iron levels, when they go up, can become harmful to the body. They are inflammatory and they can affect the liver, especially if you have a condition called hemochromatosis. Now, on a carnivore diet, of course, it's a very, very meat-heavy diet. You would think that iron would go crazy. Well, actually, no, it doesn't. Most of the time, iron levels are perfectly fine. If you do the ferritin, you do the iron studies, which I recommend doing the full iron studies, then again, most of the time, it's going to be absolutely fine. But for some people, it can go off, whether they have hemochromatosis or not. Optimum ranges are probably somewhere in the 1 to 200 range, although again, people do vary a little bit on that. If you do have slightly higher than that and you are feeling a little bit sluggish and tired, it may be sensible to think about getting a venous section done or going and donating blood if you're eligible. Lots of good reasons to donate blood as well, to see if you actually feel any better. And a lot of people actually do report to me when they go and get the blood test done, and they take off quite a few blood tests, because I do usually recommend quite a few, they actually do feel a little bit better. Now, maybe that's just placebo, I don't really know. If you do have hemochromatosis, then of course your iron levels can start to go up dramatically, and that is potentially very, very dangerous. This can happen for any reason, of course, but on a carnivore diet, it can certainly happen with a very, very heavy meat diet. So number 5 is folate and homocysteine. I'm putting these two together because they are intricately linked. Now, almost every single patient, if not every single patient on the carnivore diet that I have seen as a doctor, has a low folate level. It's within the reference ranges, but it's still low because this is evidenced by a high homocysteine level. These two are very intricately linked. Other things can affect a homocysteine level, like chronic stress, B6 levels, B12 levels as well as a few other bits and pieces. But folate seems to be the one that is particularly an issue here. I have not yet met a carnivore patient who does not have a functional folate deficiency, evidenced by high homocysteine levels, which do come down when they supplement folate or increase their folate levels. This high homocysteine is a risk factor for, again, things like cardiovascular disease. Now, as far as we're aware, it's not a direct causative risk factor there, but it's very strongly associated. Long and short of it is, if your homocysteine is high, your body's not happy. I recommend getting homocysteine and folate levels checked at least every 3 months, probably every 3 months. You don't really need to do it any more often than that. Folate can be a problem on a carnivore diet because the vast majority of people are getting folate from things like leafy green vegetables, which of course we're not eating on a carnivore diet. Now, there are some vegetables maybe that people do on a relaxed carnivore, but I'm talking about a strict carnivore diet here. Organ meats like liver and actually chicken heart, interestingly, are very, very, very high in folate. But liver, you have to eat quite a lot. So beef liver has around about 350 micrograms per 100 grams of liver. 100 grams of liver is quite a lot to be eating every day. And the RDA, we know they're kind of garbage, but for folate, it probably is actually relatively accurate, is about 300 to 400 micrograms. So you're having to eat about 100 grams of liver a day, which is probably just grossly excessive. So maybe something like chicken heart would be good. But organ meats are actively discouraged on the carnivore diet by the main proponents of the carnivore diet. So again, this is very often a problem for people. Number 6 is chronic stress markers like DHEAS and cortisol. If you don't know what DHEAS is, it stands for dehydroepiandrosterone sulfate, and cortisol, most people know what cortisol is. That's kind of our main stress hormone. The best way to think about these two is cortisol is like an acute stress. It goes up with acute stress and it also fluctuates throughout the day. So typically you go and get it about 8 to 10 a.m. in the morning. It doesn't really need to be fasted. DHEAS, dehydroepiandrosterone sulfate, it's a mouthful to say, is really more of like a chronic stress marker. Now, in men, it's a little bit more easy to interpret than in women. Women, it can be a little bit more tricky, but the key thing here is the monitoring for both of these, really. What we typically want to see is over time is cortisol going down, typically not to super low levels, but just generally not high. And also DHEAS either staying stable or going up, in fact. And the cortisol to DHEA ratio is a pretty good marker for chronic stress. And I recommend people get these done every 3 months, just again to show them, are you improving or are you actually getting worse underneath the surface? Now, number 7 is HbA1c, stands for hemoglobin A1c, sometimes just referred to as A1c. Here in Australia, we use percentages. Typically, that's what I usually use because that's just what I'm used to. HbA1c of 6.5% is pretty much the universal cutoff for diagnosing type 2 diabetes, 6% approximately being for pre-diabetes. America uses about 5.7%. Now, this is a really important one, and I have seen some people having issues on the carnivore diet with their HbA1c. Now, a lot of people out there will tell you on the carnivore diet, HbA1c goes up artificially, and it's nothing to worry about because red blood cells live longer. I'm still yet to see any real credible evidence to actually support that claim. So again, look, if you know evidence of that, let me know in the comments below. Regular monitoring for the HbA1c allows for earlier detection to show that your glucose levels are going up in your blood, and this might be causing you a problem. Often paired very well with a fasting glucose and a fasting insulin, you can start to build a very good picture. Relying on just one single factor is probably not ideal. Definitely, I would agree with that. We want to do a range of markers here and put them all together. Moving on, number 8 is liver function testing. Now, liver function testing is very, very important, I believe. And the 3 that we really want to look at are AST, ALT, and gamma GT. Gamma GT particularly is a sign of oxidative stress, and ALT is often raised in things like fatty liver disease. Now, ALT, AST, they can actually go up when we're losing weight. So I don't usually just use those as an isolated marker. I combine them with things like gamma GT as well as the whole heap of other blood tests to start to build this picture, fill in this jigsaw, so to speak, of are we actually doing well? On the carnivore diet, very often liver function will dramatically improve, but for some people it does get worse. And in fact, in the long term, it can improve. So liver function starts to come down and then it can go up again over time. So very important, I believe, to get it checked again every 3 months. Number 9, coming near to the end of the list now, is sex hormones. So testosterone, estrogen, progesterone, LH, FSH. I don't usually do those 2, but you can do them as well. Really important though is to do sex hormone binding globulin. I've done episodes on SHBG before. This is really important, and I see this missed all the time. And then, especially with men, they get their testosterone levels checked, and it's just the total testosterone, which is mostly just useless because we need to know what is actually free, what is actually active. If we don't know how much is free and active, how do you know what really your realistic levels actually are? SHBG binds things like testosterone, estrogen, progesterone, and effectively makes them inactive. So we have to know what the active level actually is. And this is really important to check. Again, typically checked around 8 a.m. to 10 a.m. Doesn't especially need to be fasted, though I usually just do fasted blood tests for all of this. There are things which can affect the testosterone. Sexual activity can affect it, of course. Heavy exercise can also affect it. Things like overtraining syndrome can reduce testosterone as well as a bad night's sleep. So we do need to factor these things into the blood tests. Again, I wouldn't be overly concerned around a single blood test marker unless it's incredibly low. But it's the monitoring that's also really important here. And then finally on the list, number 10, we have high sensitivity CRP or HS-CRP. CRP stands for C-reactive protein, which is a very, very good inflammatory marker within the body. I say good, I don't mean it's good to have high levels, I mean it's very sensitive for chronic disease and issues in the body, hence the term high sensitivity. It's also termed high sensitivity because it goes lower than the standard CRP. You need to ask, at least here in Australia, you need to ask most of the time for the high sensitivity version, not the standard. It's exactly the same on Medicare, but you have to ask for that most labs because they won't do it otherwise. And the standard CRP only goes down to 5, which is mostly just useless. We really want those levels to be as low as possible, down to 0.1, 0.2, ideally just completely undetectable. Again, typically on a carnivore diet, these will go down. Carnivore is, on the whole, an incredibly anti-inflammatory diet, though I have seen some issues with it going back up over time in the long run. HS-CRP again can be affected by many factors, injury, if you didn't sleep very well, if you've got a bit of a cold, something like that, it can go up. So again, we want to take it with a very slight pinch of salt, but again, important for the monitoring. So apart from LDL subfractions, which I recommend typically every maybe 6 months, depending on what's actually happening with it, most of these other markers I would actually recommend getting every 3 months, at least initially. Get one before you start any diet, but particularly a carnivore diet. Get another one checked in about 3 months' time. Get another one checked in a following 3 months' time. And then maybe every 6 months after that for a couple of years, perhaps. And then maybe just once a year, once you've kind of settled into exactly what you're doing and found your own rhythm. And this way, you're going to find any issues that might arise. It's no good just burying your head in the sand and saying everything's going to be great because carnivore is amazing. Look, carnivore is great for some people, don't get me wrong, but for some people it can cause a lot of issues. And the best way to actually keep track of that is to do your blood tests. Australian patients, you guys can contact me if you want a consultation. As I said, places like iMedical will also do them for a charge, of course. But the problem with that is you're not going to get a doctor to actually oversee these tests. You're going to get standard advice from the iMedical team, which is just based on standard guidance. So things like cholesterol, they're going to be freaking out about, and they're going to be telling you to go and see doctors and so on. Anyway, most doctors are not going to know what they're doing with a lot of these tests. So very good idea to get someone like myself to actually go through these tests with you and inform you of what actually is going on here and how you can actually change things. Thank you guys for listening to this episode. We'll see you in the next one.